Hello everyone, welcome to my YouTube channel Dr. Akif Beg. Today we'll be talking about why rheumatic heart disease is more common in females. As we all know, rheumatic fever is actually caused by a group B streptococcal infection, and it is equally common in males and females. It's usually seen in children age group of 5 to 15 years of age group, and at children it is equally common. That the prevalence of it is more equal in both males and females. However, it was found that when the rheumatic heart disease develops, so rheumatic heart disease develops after infection of acute rheumatic fever or recurrence of acute rheumatic fever, and usually present during the third and fourth decade of life, and it is found to be that it is more common in females when compared to males. So why there is so much of disparity and why females are more prone to get rheumatic heart disease? There has been given few explanations, so let's go to it one by one. So there are usually three main explanation which is given. One is called as greater autoimmune susceptibility. As we all know that females are more prone to get autoimmune diseases like systemic lupus erythematosus, Hashimoto's thyroiditis, Sjogren's syndrome, primary biliary cirrhosis, and other things. All these autoimmune diseases are more common in females. So as rheumatic fever is also an autoimmune disease, we've seen that there is more chances that autoimmune disease develops in the females. That's why rheumatic heart disease being developed in more common in females when compared to males. The other explanation is given that the rheumatic heart disease actually develops because of infection of acute rheumatic fever and with more recurrence of acute rheumatic fever. So, if any person exposes to rheumatic fever or group B streptococcal infection more times when compared to others, so whoever is exposed to that group B streptococcal infection more times is more has more chances of developing rheumatic heart disease. And as we all know, in developing countries like our country, like India, where women are the generally caretakers of children, and generally are more prone to get group B streptococcal infection. So all these mothers from their children, they can get group B streptococcal infection recurrently, and many times they can get that infection, and thus they are exposed more to that infection when compared to males, and thus more chances of developing rheumatic heart disease in them. The other explanation has been given that generally, if anybody is exposed to a group B streptococcal infection during childhood, and if they take a proper treatment for them within time period, if they take the treatment for it or antibiotic for it within the time period, that is within the 10 days of exposure or when within 10 days of developing the symptoms, then the chances of development of rheumatic heart disease in future is less. However, as we know that in our country or developing countries, women generally tend to go to hospital less. They generally stay with their symptoms at home only and get spontaneously or recover on their own. So they're less exposed to the primary health care. Whereas, however, males generally usually with even if they get small symptoms, also they usually go very early to the primary health center and they took treatment. So women generally take less treatment when compared to males, and thus there are more chances that that group B streptococcal infection resides in them and cause recurrent rheumatic fever and rheumatic heart disease in future. So these are the three causes. One is autoimmune susceptibility, greater exposure to infection in women, and women are less access to primary and secondary healthcare centers, and thus they're less likely they took ARF prophylaxis, and there's more chances of getting rheumatic heart disease in them. So hope you have liked our video. If you have any doubts or queries, you can text us in our message box. And if you want to see more videos like this, please subscribe to my YouTube channel, Dr. Akif Beg. Thank you.